So you've received the exciting news that you're pregnant. Now, what do you need to know to really understand and enjoy these next 9 months? Here with more is Dr. Maria Manriquez from Maricopa Medical Center's Labor and Delivery Department. Thank you so much for joining us.
You're welcome, Suzanne.
All right, let me ask you, why is it so important for women out there when they find out that they're pregnant, that they really understand the next 9 months, what it's gonna be like for them?
Well, I think expecting and having expectations and understanding what those expectations are so that you can kind of maneuver within that. And so early on, you want to know as early as possible so you can avoid things that can harm the pregnancy. And you also want to optimize your health.
Like alcohol, smoking,
Exactly.
make sure you're eating correctly.
Exactly.
So your pregnancy is divided up into 3 trimesters.
Correct.
What is the first trimester? What can they look forward to?
The first trimester is when all the symptoms of pregnancy occur. And you remember the old school movies where how we discovered pregnancy would be fainting or the nausea and vomiting. So that's true. Lots of fatigue, lots of nausea and vomiting. Maybe not for everyone exclusively, but definitely nausea and fatigue.
And fatigue. I remember the fatigue really well. And we're looking at a graphic here. I mean, roughly at 13 weeks, how big is that baby? How big is the fetus?
The fetus is probably no bigger than maybe your thumb or your index finger. So it's pretty tiny. And so often we'll be listening for the baby's heart tones, and it's not easy to hear until about 10 to 12 weeks, you know, when you go in for your appointment and we use the Doppler to listen. So it's pretty tiny, but a lot is going on then. So that's when all the organs are developing, and it's also the period of time that we want to check mom's health and make sure the baby is healthy as well with some tests. And that screening is, we are able to do it much earlier these days.
Okay, so you do that screening during the first trimester. As we move into the second trimester, how is the baby doing? What size is it? What can mom expect?
Well, this is kind of the fun part. This is when mom gets energy back and some of the nausea starts going away. Nausea is typically from 8 weeks to 18 weeks, and so now mom's feeling a little bit better. She's getting her energy back. The baby starts moving, so
I remember that little flutter butterfly kicks that you feel.
Exactly, that's the exciting time. And again, this is an opportunity where you'll have that one ultrasound during pregnancy, so we can check the baby's anatomy, make sure everything looks right. Also an opportunity to, if the baby is positioned well, to see which gender, if that's what mom and dad want.
What is that, around 18 weeks? Or
Right.
when can you really get a correct reading on that?
At 18 weeks.
At
Actually,
18.
a little earlier these days, and it all depends on the ultrasonographer and who's doing the exam.
Okay, third trimester, you're in the home stretch, but you're getting a lot bigger.
So here's the time you really have to be careful, and I noticed your shoes, Suzanne, so I tell all my patients...
You know, I would have gotten in trouble if you were here when I was pregnant, because I wore heels through my whole entire pregnancy.
So I tell my patients right away, those heels have to start coming off.
Yeah, at least throw some flip-flops on in between.
You're very, your center of gravity is a little different. You're a
start
little
to waddle.
clumsy. So you have to be careful, because even small falls can have untoward effects. So we want to be careful during this period of time. But you are having some aches and pains and back aches, and baby moves a little less because things are crowded.
Yeah, so in the third trimester, then the baby turns and the head's now down.
Right. In the third trimester, the baby's head is heavy, and so by gravity, the baby's head typically will fall into the pelvis. If it doesn't, we can help by rotating the baby externally, and sometimes we're successful and sometimes we're not. So we try to help turn that baby in the third trimester.
And mostly with a healthy pregnancy, 37 weeks. Like, what's kind of the goal that mom wants to make it to?
Now we really have to push this, and this is kind of a new paradigm, but this is very important. So now we are 39 weeks.
39.
No elective inductions prior to 39 weeks.
Oh wow!
So it's really important, because that brain development between 37 weeks and 40 weeks is just huge, and we really underestimated that. So no elective inductions prior to 39 weeks.
So it's hot and you're kind of tired of being pregnant. Sorry.
Yeah, exactly.
37 to 39. All right, I had no idea. And for all those moms out there, and they're welcoming their bundles of joy, you have a really cool billboard campaign out there.
We do. And so we encourage all moms and dads to send in their beautiful photos to our website, maricopamommy.org, so we can showcase your
We can
beautiful
all
baby.
ooh and ah over them.
Exactly.
Thank you so much. We have a lot of that's just so important too for moms out there. And I know, moms are kind of, if you just find out you're pregnant or you're a grandmother, you're trying to take down this information. Don't worry, you have a great website, a great resource for moms and dads out there. So they can just log on and ask any questions.
Perfect.
All right, thank you so much,
Thank you,
Doctor. We
Suzanne.
appreciate it. And of course, for more information about Maricopa Medical Center Labor and Delivery Department, just visit their website at maricopamommy.org or just call the number you see right there on your screen.